It's the impact on the healthcare system that is probably the biggest danger to us in this province.
Health officials say the Omicron variant tends to have less severe outcomes than previous variants, but Manitoba continues to see rises in hospitalization numbers, and ICUs continue to operate above capacity. The number of Manitobans in hospital due to COVID-19 increased by 19 Tuesday, totaling 620 hospitalizations in the province. The number of ICU patients with COVID also rising by 1 to 48. 3 more people have died due to the virus Tuesday after 20 new deaths were reported over the weekend. Dr. Kevin Coombs, professor in medical microbiology and infectious diseases at the University of Manitoba, says the strain on the healthcare system is reaching a breaking point.
If the actual numbers of case counts were going down, our hospitalizations are almost certainly going to continue to rise.
Last week, Manitoba reported a 40% increase in hospitalizations and an 85% increase in ICU numbers over the previous week. Dr. Coombs says it's difficult to predict how much worse this could get, but points out that Manitoba is getting dangerously close to having to ship patients out of province once again.
At that time, other provinces could handle our excess, but it's not clear that they can do so now.
Last week, Premier Heather Stephenson and Dr. Jaz Atwell were criticized for saying that it's up to Manitobans to look after themselves as Omicron continues to spread rapidly in the province. When asked Tuesday about the rise in hospitalizations, Stephenson says the rise is, quote, due to Omicron.
We will get through this. We will work with shared health. We will work with public health. We'll work with Manitobans to ensure that we do what we need to get to the other side of this.
Many doctors and healthcare workers in Manitoba called for a circuit breaker shutdown and stricter restrictions in the 4th wave, but nothing was implemented further by the province. As for possible restrictions, Stephenson says public health is continuing to assess the situation.
We get continuously updated on various modeling. What we've seen so far is, with the modeling is that it really hasn't been accurate. We'll continue to look at the evidence and monitor that.
But Dr. Coombs says this isn't a new virus. We have been in this situation for 2 years now. He says the current status of the hospital is all due to the government's lack of response to warning signs.
I don't want to sound like, oh, the sky is falling, but we are in a very potentially precarious situation, which is an awful lot like that movie, Don't Look Up, where people in power just simply weren't paying attention and disaster occurred. I hope that doesn't happen, but all the ingredients are there.
In Winnipeg, Alex Karpa, City News.